Hello, everyone. My name is Jingjia. I'm developing a final course project on housing options for geriatric population. The project title, Aging in Place for Older Adults. Aging in place is becoming increasingly relevant as our population grows older and more people express the desire to remain in their home and communities for as long as possible. We'll begin with a clear definition and the overall view of what aging in place means, not just stay at home, but living safely, independently, and with dignity. I'll explore aging in place through public health and legal lenses, examining the key national and local trends that shape this experience. These trends include significant demographic shifts, rising longevity, and increasing cultural diversity. From there, we'll explore the social justice issues that influence who can successfully live aging in place. Many older adults face unequal access to safe housing, healthcare, transportation, and supportive services. Structural racism, economic inequality, disability status, and language barriers all play critical roles in shaping opportunities and risk. We'll then turn our focus to the implications for urban and immigrant health. In large cities like New York, older adults may struggle with environmental hazard, social isolation, high housing costs, and limited mobility. Immigrant seniors often face additional challenge, such as limited English proficiency, unfamiliarity with the available services, or fear of seeking assistance, all of which can make aging in place more difficult. To make these issues more concrete, we look at case studies from across the country as well as right in our city. These examples will help us identify system gaps, understanding community strengths, and recognizing the impact of policy decisions on everyday lives. We also will discuss existing solutions and emerging innovations, from home modification program, caregiver support, and integrated healthcare models to policy reforms aimed at improving housing stability and social connection. Finally, we'll spend time on how to effectively disseminate information to older adults, including considerations for language, accessibility, cultural relevance, and trust building. I'll introduce a sample program proposal and conclude with a homework assignment designed to help you apply what we've covered in today's presentation. By end of the session, you'll be able to describe the core component of aging in place, of aging in place, identify key disparities, analyze both urban and immigrant experiences, evaluate real-world cases, and understanding the strategies and communication method need to support aging in place effectively. I'm excited to explore these important issues with you. Let's start with the public health and legal context that shapes aging in place in the United States. At its core, aging in place reflects the preference of most senior adults to remain in their own homes and community rather than move to institutional care. From a public health perspective, this preference aligned with strong evidence showing that stay in a familiar environment support psychologically well-being, autonomy, and sense of continuity. It also plays a direct role in disease prevention and management. Community-based programs, home modifications, and supportive services can reduce falls, help manage chronic illness, and address mental health concerns, ultimately delay disability and dependency. Aging in place is also cost-effective. Supporting someone at home is typically far less expensive than long-term care in a facility. Programs like Capable Model, which pairs clinicians with handymen to make safety improvement, demonstrate how simple upstream interventions can significantly reduce hospitalization and emergency room visits. And finally, strong community networks, especially those fostered by age-friendly city initiatives, help combat social isolation, which remain one of the most significant public health risks for older adults. On the legal side, aging in place in the U.S. rests on the framework of federal and state policy. The Older American Act, OAA, passed in 1965, created the National Aging Network that funds essential services like meals, transportation, caregiver support, and legal aid. Medicaid plays an equally important role by financing home and community-based services through various waivers, which allow older adults to receive long-term care support without entering a nursing home or exhausting all their assets. Housing and accessibility laws include the Fair Housing Act and the Americans with Disability Act ensure that older adults have the right to accessibly living environment. These laws support practical home modifications, from grab bars to ramps, that enable safer aging in place. Many states are also adopting comprehensive master plans for aging, creating coordinated policy roadmaps that bring together housing, healthcare, and social services. Finally, elder law provides critical protections such as estate planning, guardianship, advance directive, and safeguard against elder abuse, all of which help older adults maintain control over their living situation and care decisions. Together, this public health and legal framework provides a powerful foundation for supporting aging in place and meeting the needs of a rapid growing older population. Now let's take a moment to talk about why aging in place matters and what it truly involves. Across the country, more than 75% of adults age 50 and older say they want to remain in their homes for as long as possible. This preference is not just about comfort, it's about autonomy, dignity, and maintaining control over one's daily life. And from a system perspective, aging in place can significantly reduce healthcare and long-term institutional costs when the right supports are in place. Successful aging in place rests on several key components. First is safe and accessible housing. This can mean simple home modifications such as grab bars, ramps, better lighting, and fall prevention design that dramatically reduce the risk of injury. Second, older adults need reliable health care and home-based services, including home health aides, telehealth options, and support with medications or chronic disease management. Another essential piece is social connection. Loneliness and isolation are major public health issues among older adults, and staying connected through community centers, senior programs, or even virtual platforms makes a profound difference. Transportation also plays a critical role. Whether it is accessible public transit, paratransit, or community ride services, mobility determines whether someone can see their doctor, buy groceries, or stay socially engaged. And finally, financial stability. The ability to afford housing, utility, food, and care is a foundation that allows all other pieces to function. But aging in place is not without any challenges. Rising housing costs are pushing many adults, older adults, out of neighborhood they lived in for decades. We are also facing significant caregiver and workforce shortages, making it harder for deliver home-based support. Many older adults experience cognitive decline and mobility limitations, which require specialized care and ongoing monitoring. And our healthcare system remains fragmented, making it difficult for older adults and families to navigate multiple providers' benefits and services. Aging in place, the ability for older adults to remain in their home and community safely and independently is an aspiration shared by the vast majority of seniors. But when we look at it through a social justice lens, it becomes clear that aging in place is not equally accessed to everyone. In fact, it often reflects the lifelong pattern as advantage or disadvantage. Let's start with housing. Older adults of color are significantly more likely to live in poor quality or overcrowded housing. This isn't accidental. It reflects decades of redlining and discriminatory lending practice that have limited home ownership, reduced the home equity, and restricted the ability to afford basic safety modification like ramp and grab bars. Economic disparity also play a major role. Women, Black, and immigrant seniors tend to have low lifetime earnings, which translate directly into lower Social Security benefit. Many struggled to afford private home care or even the basic cost of remaining in their homes, housing, utility, food, and medication. Technology is another emerging barrier. As healthcare benefit and even social connection moved online, digital literacy and broadband access have become essential. Yet many older adults, especially low-income, rural, and immigrant seniors, remain disconnected, widening the gap in access to services. Healthcare access is also far from equitable. Undocumented older adults may avoid the government program out of fear. Language barriers persist, and the culturally competent care is still not the norm. As a result, many seniors who need support the most are the least likely to receive it. And finally, we must acknowledge ageism. Too often, older adult preferences are overlooked in planning, urban design, and policy decisions, as though autonomy somehow diminished with age. When we step back, the pattern is unmistakable. Aging in place is frequently framed as a universal goal, yet the ability to achieve it is shaped by a lifetime of social, economic, and structural inequality. Ensuring that all adults, older adults, not just most resourced ones, can age safely and with dignity required us to confront these systematic barriers directly and design policies that center justice, access, and equity. When we consider aging in place, it is essential to understand how urban environment and immigrant experiences shape health outcomes for older adults. These factors don't just influence comfort. They directly affect safety, access to care, and long-term well-being. Let's start with urban health implication. In many cities, older adults live in high-rise buildings that may lack reliable elevators or accessible exits. For someone with mobility limitation, something as simple as broken elevator can mean being effectively trapped at home. Dense neighborhoods can offer excellent proximity to clinics, pharmacies, and community centers. Yet they can also present a real safety concern, from traffic risk to neighborhood violence, which may limit an older adult's willingness to leave their home. Urban environments also come with environmental burdens, pollution, constant noise, and the growing threat of urban heat island. This disproportionately affect the seniors, especially those with chronic conditions like asthma, heart disease, or diabetes. Now let's turn to immigrant health implications. Many older immigrants live in multi-generational households. While this can provide strong family support, it may also limit privacy or complicate caregiving dynamics. Language barriers remain a major obstacle. Navigating essential benefits like Medicare, SNAP, and home care becomes significantly harder when materials and services are not linguistically or culturally accessible. Cultural beliefs also matter. In some communities, there is stigma around accepting formal help, such as home health aides or social services. As a result, immigrant seniors may underutilize the very program designed to help them remain safe and independent. Finally, insurance coverage is uneven. Older immigrants are more likely to be uninsured or only partially insured, which affect their ability to access preventative care, specialty care, and long-term services. So these urban and immigrant health factors highlight a key truth. Aging in place is deeply shaped by one's environment and cultural context. Addressing these gaps require policies that prioritize accessibility, linguistic inclusion, and culturally competent care, ensuring that all older adults, regardless of where they live or where they come from, can age safely and with dignity. To understand what aging in place look like in practice, it's helpful to look at real-world examples, both national programs and local initiatives that show what works and why it matters. Nationally, one strong example comes from Minnesota's Home Modification Program. This state-funded program provides low-cost home repairs for low-income seniors. Things like grab bars, better lighting, and safer stairways. The impact has been substantial. The program has reduced the fall by nearly 30%, allowing thousands of older adults to stay in their homes safely for longer. It's a clear demonstration that small targeted investment in the home improvement can yield big health and financial benefit. Another national model is PACE, Program of All-Inclusive Care for the Elderly. PACE integrates medical care, social services, rehabilitation, transportation, even meals, and all are coordinated through one team. It's designed for frail seniors who might otherwise require nursing home care. The data consistently show that PACE participants experience fewer hospitalizations and lower nursing home admission rate. It's a model of what holistic community-based care can achieve. Here in New York City, NORC program, Natural Occurring Retirement Community, offer a powerful local example. These are buildings or neighborhoods where largely number of older adults already live in. Instead of relocating residents, services come to them. On-site nurse, social workers, fitness classes, and social programs help older adults stay connected and independent. For many New Yorkers, NORCs provide not just the services, but a sense of belonging and the community. Finally, consider an anecdote case from Sunset Park. An older Chinese immigrant living alone relies on meals from her local senior center, but declined home care due to language barriers and cultural concerns. After attending a bilingual fall prevention workshop, she felt comfortable enough to make small home modifications. Those changes significantly improved her safety and confidence at home. This case reminds us that culturally and linguistically tailored programs aren't optional, they are essential. These examples show that aging in place succeeds when services are accessible, culturally responsive, and rooted in the realities of people's home and community. When we think about how to support aging in place, it is important to recognize what many effective solutions already exist, but there are also major gaps that need to be addressed. Right now, a number of promising initiatives are helping older adults remain safely in their home. Home modification grant offers through HUD and local housing agency help seniors install grab bars, improving lighting, or make accessibility upgrade they otherwise couldn't afford. Telehealth has expanded dramatically, giving homebound older adults easier access to medical care without needing to navigate transportation or mobility challenges. Local support also played a big role. NORC programs and senior centers provide on-site or neighborhood-based social work, nursing, and community programming. Caregiver support services include training, respite, and counseling, help family manage the day-to-day realities of aging in place. And essential services like home-delivered meals and community transportation ensure that basic needs are met. We'll also see more investment in technology training for older adults, which helps bridge the digital divide and allow seniors to access telehealth benefits and social connection tools more confident. But despite these efforts, more work is still needed to make aging in place truly accessible for everyone. A major priority is expanding Medicaid funding for home care, especially as workforce shortage grow and many families struggle to afford private care. The U.S. also faces a shortage of affordable senior housing, so increasingly supply and preserve existing units is critical. Strengthening the health caregiver workforce through better wages and job support will be essential to meeting future demand. Culture and the linguistic barrier also need more attention. Expanding culturally competent programs and language accessible services would help ensure immigrant and marginalized communities can use available resources. We also need to think more creatively about housing. Intergenerational living models, for example, can reduce loneliness, improve safety, and share costs across generations. Finally, improving neighborhood walkability and transportation option is a key. Safe sidewalks, benches, reliable transit, and accessible street design all contribute to an environment where older adults can remain active and independent. These solutions, both current and emerging, point toward a more equitable, supportive future where aging in place is not just a preference, but a realistic option for all older adults. To ensure that information about aging in place truly reaches the people who need it, we have developed a target dissemination strategy called Stay Strong at Home, a community guide to aging in place. This program is designed to meet older adults where they are, literally and culturally, and provide clear, practical guidance in accessible format. Our target audience include adults 60 and older, family caregivers, and immigrant households, who often play an essential role in supporting elders but may facing language or system navigation barriers. Because these groups access information in different ways, outreach strategy is intentionally diverse and culturally responsive. First, we plan to deliver in-person workshops at senior center, NORCs, churches, libraries, and other trusted community spaces. These sessions will offer hand-on demonstrations, Q&A times, and direct connections to local services. To reinforce these sessions, we distribute large print, plain language brochures in multiple languages, ensure accessibility for those with visual or linguistic need. Recognizing the central role of digital communication, especially in immigrant community, we will also produce a short, easy-to-follow videos for WhatsApp and WeChat covering key topics like home safety, fall prevention, and how to apply for financial assistance. In addition, telehealth orientation sessions will guide older adults through using virtual care tools, helping bridge the digital device. For individuals who face mobility or transportation challenges, we will integrate home visit by community health workers who can offer personalized assessment and help connect the families to available support. Across all materials, our key message remains consistent. How to make your home safety and more accessible, what financial assistance program exists locally or federally, where to find transportation meal program and home care services, and most importantly, why social connection is essential for healthy aging. To strengthen credibility and reach, we'll build a partnership with local senior centers, immigrant-led community organizations, health systems, and NYC Department of Aging. These partners will help share information, host the events, and integrate our program into existing community networks. These efforts form a comprehensive, culturally competent marketing and outreach plan designed to empower older adults to age safely, confidently, and comfortably in their homes and community. Okay, for today's homework, I'm asking everyone to creating what I call your aging in place readiness plan. The goal of this assignment is to help you reflect on your own environment, your personal needs, and the resources in your community so that you can think practically about what safe and independent living might look like for you or your loved ones. First, you will complete a single home safety assessment using the checklist I will provide. This helps you take a close look at the area like lighting, fall risk, bathroom safety, and general accessibility. It's a hands-on way to connect what we discuss in class with your actual living environment. Next, I'd like you to identify 3 personal challenges you might face when aging at home. This could be physical, social, emotional, or even financial. Calling out these challenges early helps us understand how different factors intertwine to shape someone's aging experience. Then please research and list the 3 local resources, such as the senior center transportation programs or home modification services. Part of aging in place is knowing what support exists around you, and many people are surprised by the options available in their own neighborhood. Finally, you will write a short 150 to 200 words reflections on what aging in place means to you personally or someone you cared about. This reflection helps deepen our discussion and ties your lived experience to a broader theme of environment, health, and social connection. Please bring your worksheet to our next session, and we will use to explore how real-world setting, community support, and individual needs all come together to influence a person's ability to age safely and comfortably at home.